Hey friends, Dr. Steve Hruby here, and if you're watching this video, there is a good chance that perhaps you were in an auto accident recently. And one of the first questions I often get asked when somebody's been in a car accident is, who should I see first? Should I see a chiropractor? Should I see a medical doctor? Well, why don't you potentially do both? Here at Kaizen, we are a fully integrated medical office. So we have both a chiropractic component as well as a medical doctor. And truthfully, when you've been in an auto accident, you really should be assessed by multiple doctors. So if you're watching this video, let me tell you a little bit about myself, which is, my name is Dr. Steve Hruby. I am the head chiropractor here at Kaizen Progressive Health. We're located in North Scottsdale, right off of 101 and Frank Lloyd Wright. And if you've been in a car accident, it's really, really important that you get assessed by the appropriate doctor, the appropriate office with the appropriate technology. So the technology that we're going to use to assess you when you've been in a car accident is we have digital x-ray, which is right here behind me. And then we also have a technology here called a surface electromyogram, which is going to measure very specifically if there's been damage to your nervous system. Both these tests are non-invasive, so we're not going to be jabbing needles in you or anything like that. You will be assessed by a doctor of chiropractic. I'm also a licensed physiotherapist. You are also going to be assessed by our medical provider on staff as well too. And you're going to get assessed a little bit differently by both doctors, and we're both looking for different things. But here's the point when you've been in a car accident. First of all, you may have aches and pains. But even more important to understand is you may not have aches and pains when you've been in a car accident. And very often we see people here in the office who've been in a car accident, they feel maybe a little banged up, and they feel okay after the fact, or they feel like they feel okay after the fact. And maybe 2-3 months down the road, all of a sudden a lot of problems start popping up for them that they just weren't aware of, and they should have been assessed in the first place. So if you've been in any kind of car accident, the first thing I would tell you, it's very important, whether you feel good, whether you feel bad, to get assessed. And when we're assessing, and I'm going to talk a little bit about what we're looking for, one of the most common things you're going to see with a car accident is whiplash. And whiplash happens simply because when there's a sudden accident or trauma, your neck gets whipped around. This can cause a lot of problems. It can cause structural damage. I have actually found in my career 2 broken necks. People who literally came in with a broken neck, and in both cases, both those people actually went to the emergency room. Both those people got x-rayed, and in both cases, the emergency room missed the fracture in their neck. Pretty scary when you think about it. So it's really important when you're getting x-rays assessed that you're getting assessed by somebody who has a lot of experience in knowing what they're looking for. They're taking the proper views, so they're not going to miss something like a fracture or dislocation that's going on. Both those patients, they ended up being okay, but both those patients, I mean, somebody could have bumped into them the wrong way and they could have ended up paralyzed. So very important that you get assessed. There can be all kinds of ligament damage, muscle damage. Often when we're suspecting those things are going on, we're going to refer you out for an MRI so we can look at specifically what's going on with those types of damage. Very often now, and we're seeing this more and more often because the technology's got a lot better, you may have some type of damage to your brain. It does not just take a concussion, which often will happen in car accidents, but simply that shaking your brain can cause a lot of damage to your brain. These can show up in all kinds of ways physiologically with your body, but they now have technology with MRIs that we're often seeing remnants of this damage that's been caused by the car accident you've been in that you probably wouldn't have been aware of 10 or 20 years ago. These are the type of injuries that, frankly, people like football players are suffering with. So very important that you get assessed by somebody who's going to be able to look for these things. Now, that's just talking about the neck. You're in the seated position, so often we're seeing low back problems. We're seeing upper back problems with people. We see a lot of extremity issues. Often airbags are going off. This can cause burns. It can cause bruising as well too. But often, based on where your hands might be, those airbags can go off. They can cause all kinds of damage to the upper extremities. People get sideswiped, so they might bang their knee, they might bang their legs. I mean, a lot of different things can be going on when you've been in an auto accident. And it's really important when you're in an auto accident, like I said, to get assessed. You don't want to take chances with these things. Like I said, we've seen some very serious things over the years. Now, one other thing that I want to tell you that's really important when you've been in an auto accident is there is often a legal side to your case that you're getting when you've been in an auto accident. Meaning you may be dealing with attorneys, whether you want to or not. I know I'm not the biggest fan of dealing with attorneys, but that's the reality often when you're in an auto accident. And what becomes very important on that side is that the office that you go to, the doctors that you're seeing, know how to properly document. There's just a way that attorneys want to see your notes, documentation. They want to see that you've been doing specialized testing. It is to your advantage, actually, that you're seeing multiple doctors. Often, if there's more advanced things going on with you, we might be referring you to a neurologist or other specialist. I mean, if you have a broken bone, you need to see an orthopedic to see if you're going to need surgery. So we are very well equipped. I personally have 22 years experience. I've dealt with hundreds of personal injury cases, both on the treatment side and then also on the legal side of it. So very much to your advantage to make sure that if you've been in a car accident, not only are you getting the care that you need, that's first and foremost, and that includes any family members that are in a car with you, but that you're also going to somebody who's going to know how to help guide and navigate you through the legal side, which I know isn't fun, but is a reality of these situations. So if you have questions, please call us. If you've been in an accident, please schedule an appointment, and we are going to be happy to take care of you and get you back to feeling like yourself. Bye for now.